I've written 2 books on the heart. One was entitled Magnesium, the Ultimate Heart Medicine. And the second, which I wrote 30 years ago, was called Heart Health. The book on magnesium was about the pump. Heart Health was about the emotional center. That is in our chests. In Indian philosophy, they call it the heart chakra. It relates to the color green, and it's basically our security center, where we feel secure or insecure. It's the center of our emotions and feelings. And in this book, Heart Health, I define the heart as the vulnerability of being. Basically, we can reduce life or psychology to the head versus the heart. The head thinks, and people who are really in their heads, which is most people in modern civilization, are thinking from the first moment of the day to the last and have a hard time going to sleep because they keep thinking. I talk about, and on my site, drsircus.com, talk about the tears of the melting heart. When we drop from our minds into our hearts, there are tears that run down our face. And if we leave our hearts, those tears come back. I define the heart as the organ of truth. That you can only be in the heart when you're with truth. The heart can only stand the truth and be with the truth. The minute you leave the truth, you leave the heart. And that essentially is what infidelity is about. Infidelity has less to do with sex than it has to do with lying and hiding. If you're married and make love to somebody else, and you hide that from your wife or husband, the lie drives one out of their hearts. And the other person feels that, on some level can feel that. There are some people who define cancer, and I never like the use of the word all, but all cancer comes from a conflict inside the brain. And the most basic conflict is between the head and the heart. Cardiology is about the heart. Many people will talk in terms of cancer and emotional causes and patterns, but the heart, cardiologists, they're more interested in prescribing statin drugs, which are very toxic, and blood pressure pills, etc. Many heart patients are on many drugs at the same time. My biggest mistake in life in writing my 2 books on the heart was that I didn't pay any attention to my vascular system until I almost died of vascular disease. I was an emergency patient, about 17 months ago. And I had 2 almost totally blocked arteries, cardiac arteries. One was 91% blocked, the other one was 98% blocked. And after a year of rejecting doing a catheterization, I finally did it. That's when they diagnosed me. My sister, who's a nurse in the United States, was very surprised after looking at the test that they even let me out of the hospital. I could hardly walk. I fell 3 times. It's very difficult to get out of bed. And they wanted to I went to 5 cardiologists, and of course not one of them mentioned anything about magnesium. And So they scheduled, I had a private doctor who put me in the public system and scheduled stents, 2 stents. But then my private doctor wanted me to do the stents with a specific doctor who had the best materials. But he went on vacation, and then they went on strike, and it took so long to schedule the stents that my own natural allopathic protocol started pulling me out. I was getting better and better, and good enough that when they finally called me to schedule the first stent the next day, I said, thank you, but no thank you. Put me at the end of the list again. And because I had just also found out that there's a 2% chance of serious complications from stents. Though most people, 98%, report getting quite a bit of relief. At that particular moment of time, I found out about cyclodextrins. Cyclodextrins, like PPC, when injected or through IV, will start cleaning the plaque out of the vessels, out of the arteries. But there was a company in Brazil. There's not one person who does injections or IVs of cyclodextrins, but there was a company. It's now probably been 4 years that developed a liquid suppository, or they call it an enema. That instead of injecting, you do these enemas and pretty much promise reasonably quick results. And I was hoping, as I rejected the first stent operation, I was hoping to get it into Brazil. It was shipped twice into the country and rejected by the post office. I told the company it's not the way to ship it DHL. The third time it came through. I started taking these cyclodextrins, which are like dive bombers. Once in the bloodstream, it's like an ice cream cone. They're made from fermentation of starch. So they like sugar cones, like an ice cream cone. And the narrow end is attracted to water, and the thick end is attracted to cholesterol. So each cyclodextrin will dive bomb into plaque and yank out a cholesterol, thus starting the process of cleaning the arteries. I've developed a full protocol, call it Natural Cardiology. I have a book, Unclogging Your Arteries. And it's a total alternative to mainstream cardiology, which relies on operations, one after another after another. I talked to a patient this just past week. She said she has 29 stents. Hard to believe. When I got the cyclodextrins, they called me again. I was at the end of the list, and they called me again to put a stent in, and I said thank you, but no thank you, and take me off the list. And now it's from that point, it's about a year later. I look. You can just see how I look. I don't look like I'm dying. I don't feel like I'm dying. Probably 1,000 or 2,000% better. Have I reached nirvana yet? And back to full activity and being able to run marathons? No. But I have survived and thrived and avoided risky surgery through using a full protocol led by cyclodextrins.
My heart almost failed, but through Natural Cardiology, Magnesium, and Cyclodextrins, I found another way. If you still believe the heart deserves truth and real healing, follow me on Substack, subscribe for free to stay connected, or become a paid member for exclusive videos. And remember, the link to get my books is in the description of this video on Substack.